right now Adolfo is here. I want to welcome everyone to the new academic year grand rounds. I think we have a interesting program lined up for almost for the whole year. And usually we have child psychiatry grand rounds first Wednesday of the month. I mean, I think there are maybe November, December where we may have 2 child rounds, and it may be on different days too. I want to, introduce our speaker. I'm really honored to have Dr. Thomas Brunner here today, and he will be talking about advanced anger assessment using anger profiling to assess a psychological vital sign. He doesn't have anything to disclose as far as financial disclosures. Let me tell you briefly about his background. Dr. Brunner, he is a research associate of the Center for Research in Behavior Medicine and Health Psychology at the University of South Florida. He has published several journal articles and book chapters related to personality assessment, and recently authored an article on assessment of anger that has been included in a book edited by renowned learning expert Dr. Nancy Mather. And he has received awards from Society for Personality Assessment and also from Arizona Psychological Foundation, which honored him with the Early Careers Psychologist Award. He regularly presents at local and national conferences on the topic including anger and assessment. And he's the senior author of Youth Self-Report, Measure of Anger, that's being adopted into 5 languages. And he did his MA, PhD from University of South Florida, and also his BA from Tulane, and MA from University of Chicago. So with that introduction, I will ask Dr. Brunner to come and give us a talk. Thank you very much for coming.
Okay, so I'm told I'm not supposed to move from this spot. So I'll try not to, but I do tend to move around a little bit. Thanks for having me today. I only have 150 slides, so we should be able to get through a third of them. Just kidding. My style is really to present the fewest slides possible and then open it up for questions. So my slides will be refreshingly simple, unlike a lot of talks where they give you loaded slides. So if you can try and hold your questions, unless it's just critical and you think that everybody is sort of not getting something, then feel free to ask it. But otherwise, if you can try and hold your questions to the end, that'll be great. Never hurts to start out with a little humor. All right, so here's my title. And, I wanted to have the phrase anger profiling in there. And that's kind of a loaded term. I did that intentionally. Of course, what I'm going to talk about today is anytime any child roughly, even approximately fits a profile, we're going to throw them in jail and throw away the key. Just kidding. Profiling is a loaded term, and we're going to get into today a very thoughtful way to look at profiling, if you will, as it relates to anger. And, anger, I really think of as a psychological vital sign. It's really snuck up on researchers. It's really been ignored. And so I think, and I hope this talk will be interesting. Okay, so I think of anger kind of like a crocodile. And I really love this image that a friend sent to me. I mean, here's a guy, Cheeto, who befriended a crocodile. I mean, who would ever guess you can befriend a crocodile? But what I want to try and do today is get you to have a feeling of that you can really get to know anger and its dynamics, so that when someone presents clinically or you're conducting research on anger, you can get to know it and swim with it even. Okay, so learning objectives for today. I want you to get angrier about the lack of anger assessment. For researchers out there, there's probably a lot of grant money for looking at anger and things like bullying, which is getting to be a very hot topic. Recognize how vital anger assessment is in whatever roles you serve. I want you to try and internalize a framework to handle the varieties of anger that are out there. And hopefully we can have time to practice using this framework a little bit to spot common profiles. Familiarize yourself with some common anger dynamics and learn to see some red flags that might suggest a particular response. So, okay, 5 sections. First, we're going to talk about anger really is everywhere these days. You know, Rollo May coined the term the age of anxiety in terms of with nuclear threat with Russia. I think now you could really argue we're in an age of anger. I mean, it's everywhere. Road rage. You know, there's a lot of talk of, well, there's, of course, the school shootings. That's become big news. If you really think about it, anger has become front and center, and yet again, there's not much research on it. By the way, if I start sounding I'm too close to the mic, just go like this. Okay, section 2, what we've learned about anger, and I want to talk a little bit about the few things we've learned, and we haven't learned much. Section 3, I'm going to talk about a measure that I'm an author of, and so actually there is a financial disclosure. I'm an author of it, and so please note that if you bought this measure, I'd probably get a few pennies. All right, section 4 would be what I think is the destiny of anger, and then we'll do Q&A if we have time. Okay, so section 1. I think, again, anger is a dominant problem. If you look at school shootings, for example, it would be hard to argue anger was not involved in those school shootings. Now, unless you have a truly sociopathic individual who just completely enjoys killing, anger is going to be a component, and it's been shown to be a component. Okay, violence, suicide, you can think of suicide as anger turned toward the self. That's a discussion, but hypothetically you can think of it that way. Bullying, there's an element of anger we'll talk about. Even in learning disabilities, even in ADHD, even in anxiety, things you wouldn't think about. And so here's the point. Scientifically and diagnostically, can you think of a DSM diagnosis for someone who just has an anger problem? Well, in a child, it would be what? Oppositional defiant disorder, or maybe intermittent explosive disorder, right? Nothing for an adult, really. And yet you can think of friends, family relatives, that have just an anger problem, and otherwise they may function pretty well. So why do we have anxiety so well mapped out, or we're trying to map it out? Why is depression so mapped out, but anger isn't mapped out? I mean, to me it's very surprising. There's a real lack of prominence of it, so it's really snuck up on us. And yet it's one of the most primary emotional states. If you go back to Charles Darwin's work, he talked about high levels of anger in terms of anger, rage, in addition to anxiety and sadness. So it's a primary emotional state with a deeply functional evolutionary value. Obviously, it helps us with survival. It helps us with motivation when we want to win, when we want to compete. Anger should by no means be looked at just as a negative emotion. There's very positive ways that anger can be used. Even in treatment, when you're working with someone, if you know their anger style, you can actually use that as a treatment variable. So I think of it as a fundamental vital sign. And my senior colleague, Charlie Spielberger, coined this term of psychological vital signs: anger, anxiety, and sadness. Physicians have vital signs. We psychologists and psychiatrists and mental health practitioners should have vital signs. So right now, if you think about it in your work, if you work with clients or you oversee people who do, how do we assess and triage anger? What are questions we ask? How angry are you right now? How well do you control anger? Do you ever hide your anger? Is that a question you ask? That's probably a question that should have been asked to a lot of the kids who went on to become school shooters. Do you ever hide your anger? I mean, that's a simple question, but if it had been asked, probably some of those shootings could have been prevented. So in a chapter I wrote, I really talked about a key problem in assessment right now. And I don't know, how many people use a broad screening measure to assess a wide variety of conditions at once, like the BASC or the MASC or the CBCL? Anybody use just a broad screening measure in your work? Okay. So the problem with those measures is those measures tend to be a yes, no. Like, they'll sort of tend to, let's see if I have, okay. You know, it's like, well, if it's above clinically significant, then okay, then it's significant. But what I'm going to talk about today is I think the way assessment is evolving is it's becoming more not just categorical, because we need to break things into categories, but also dimensional and looking at the full spectrum or intensity of a phenomena or frequency of it. So, for example, I use the MASC. I don't know if anyone uses it, the Manifest Anxiety Scale for Children. It's a great measure of anxiety for kids. That breaks anxiety up into subtypes, rather than just do they have anxiety or not, which is a lot more useful to me and maybe for you. The brief is another great measure for executive functioning in terms of ADHD. It looks at monitoring, ability to shift focus, etc. That's another measure that does a nice job of looking at the facets of a phenomena rather than just, well, do they have a problem with it or not? But I understand we need to have measures that are very simple too. So, okay, what have we learned about anger? Well, again, it's been understudied, so if you're looking for a dissertation topic, a grant proposal, I would really think about anger. A paper, if you're an undergraduate, anger is so understudied. It's like virgin territory. It's like there's so many things that could be done in the world of anger. We know at least has first of all, we know it's a complex process. Okay, and you're sitting there going, duh, well, we know it's a complex process. And Charlie Spielberger, my mentor at USF, used to say, remember, Tom, it's a process. And I'd be like, okay, can we move on to, And it really just, it hit me years after. I went, there's really something powerful about saying anger is a process. Just like anxiety or depression, you can say that for any emotional state, but there's like stages to it, and we're going to talk about those today. But we at least have 3 in anger: experience, expression, and control. How do you experience something? How do you express it then? And then how well do you control it? It at least has 2 aspects, and again, you could say this for other psychological phenomena as well. A state, right now, how much is this phenomena present? And then a trait or a preference. How frequently do you experience this phenomena over time? So we at least know this. Okay, so let me just throw a couple sort of statistics just to bring it into the real world. First of all, school shooters are not uncommonly anger internalizers, meaning they tend to be those who would conceal their anger. Okay? Which is probably why no one caught it. Secondly, aggression is highly correlated to trait like anger, meaning somebody who tends to experience anger more frequently. That's trait like anger. Okay? And they tend to have lower anger control. You could say, well, that's a no-brainer, but we'll get into how this all plays into a larger profile and bigger picture. Bullies are often higher in trait anger. Okay? Those who are bullied or teased, and this is interesting here, may tend to have lower trait anger reactivity. Now, trait anger reactivity it's a subscale on a measure we're going to talk about where to what degree do you get angry when people criticize you or you're in evaluative situations? Now, if that's really low, what does that say about maybe your sense of self-esteem? And I don't mean in the middle, I don't mean in the normal area or the range, let's call it. I mean very low. Well, it means that you may not even advocate when you should. And so obviously people who are going to be picked on may be those who will under-respond. Okay? That's the importance of a dimensional measure. Remember I said, well, if you just use a measure with a cutoff, you're never going to catch the importance of low scores. Okay, in students with learning disabilities, this is interesting. If you work with kids with learning disabilities, you may think, anger, no, that's not related. We're on cognitive things here. I'm a neuropsychologist. Right? Well, actually, there's some studies that suggest that they're often higher in trait anger. And would you need to take anger into account when you're trying to teach someone to learn something or you're trying to assess their learning style? Yes. Okay, so now let's get into another area, which is threat assessment. And the idea that, some people could say, well, shooters or people who become violent, they just snapped. Well, that's really a myth. And there's a lot of warning signs. I quote a couple studies down here in terms of some large-scale studies that have been done, actually, with the National Threat Assessment Center. And, the thing to remember is often violence represents, it's a pattern of thinking and behavior. And so when you use self-report measures, you could think, well, they'll never openly report that stuff, but you'd be surprised even. Sometimes youth, and some of you all have experienced this, they won't tell you, but they will answer yes to it on paper and pencil. Okay? So that's another value of a self-report measure in addition to an interview. Okay, so here's just to give you a sense of magnitude. List of school shootings that have occurred. And, you look at this, and of course, again, look, as scientists, you always have to look at base rate. It's a low base rate compared to all of the United States, okay? But still, you have to remember that oftentimes there were certainly discernible signs. And if any of you work with kids who you think, well, there might be a little bit of a violent streak or aggression, I would highly recommend you consider using a measure that looks at anger, because if they turn out to have certain characteristics, then those are things you want to account for. Okay, so I'm going to talk about this measure, the STAC-C2CA, the State Trait Anger Expression Inventory, second edition for children and adolescents. Okay, and just to give you an idea of how would it assist with school risk assessments. Well, one interesting thing I found, and I don't know if you found this if you work with youth, but what's funny about with parents is if you brought up, well, your child has problems with anxiety or they have problems with depression, oh, no, that's a trickier talk sometimes. But if you bring up anger, it's actually easier to talk with parents about anger than the other two emotional phenomena. Maybe in America, because maybe aggression and violence are a little bit more accepted. But what I'm trying to get you to think about is there are many different reasons why assessing anger can give you more leverage with people you work with. Current risk assessment measures that I've reviewed, and I'm not an expert on risk assessment, but I have presented on it, they tend to focus more on demographic risk factors. Okay, has there been violence in the family, criminal record, et cetera, et cetera, et cetera. Not much on, for example, internal or more hidden aspects of anger, like suppressed anger. Okay, so Section 3, the measure. I call it a clutch player because I think it's a very flexible measure. It's a self-report. It's for kids aged 9 to 18, fourth grade reading level. It's very brief. I think of it as comprehensive but concise. And again, I want to really highlight it's dimensionally, not diagnostically based, although it can obviously aid in diagnosis. Okay? My colleague, Charlie Spielberger, and I authored this measure. Charlie's really well known. He has developed several state trait measures. The child measure is modeled after the adult measure, which has been adapted into 27 languages. So Charlie is, he wanted me to write up an invitation to a party he was throwing, and he accepted the 7th version. So he was a pretty particular guy. He was really a really brilliant person. But that's sort of who I did the measure with, just to give you a little sense of the team. Why did we do a child measure of anger? You could say, well, there was an adult measure. It went down to 16 already. Well, there was already robust data regarding using that adult measure with kids down to 16. Over 100 studies had already used these concepts, the same concepts on that adult measure, went on to the youth version, etc. We are currently adapting it into 5 languages. So, strong psychometric properties. And I'm just going to sort of give you an overview of it without getting too much into psychometrics. We can handle that at the end. There's 5 scales and 4 subscales. And there's 13, I call them concerning items, not risk assessment items. We have to be very careful. Concerning items, okay? Non-overlapping scales. It's not like some measures where you have the same item on 2 different or 3 different scales. And is based on a large census-matched normative base. Again, it draws from the state trait idea of the here and now, and then frequency. There's strong alphas, and when we looked at does it differentiate clinicals from controls, it did. And here's just a quick overview of the demographics for the normative base. We started with about 1,000 kids, and for anyone who's done a large study, you know you lose people. There was no systematic loss. There was no bias in terms of, well, all the kids from a certain school or a certain ethnicity. It was just really missing data here and there, so we made sure to check that. But we represented the different ethnicities quite well, actually. Very balanced male to female. So, okay, here are the concerning items, just so you can actually now kind of put your hands around the measure itself. So remember, there's various scales and subscales, so I've given you, for state anger, a couple the items that are on state anger. I feel like hitting someone, I feel like kicking somebody. Trait anger, I get angry quickly, I am hot-headed. Hot-headed is real fun, like when the Turkish research team is trying to translate that term. I mean, that's all we had all kinds of discussions. Okay, anger expression out, I say mean things. Anger expression in, if I don't like someone, I keep it a secret. Okay, this is a really interesting scale right here. I hide my anger. I'm afraid to show my anger. Okay, so here is, and you have a sheet, I hope, one of your handouts that you can put in front of you if you wish. Here's the overview, the complete overview. There are no more scales and subscales. This is the busiest slide I'm going to show you today. All right, so there's state anger and there's trait anger. So before you get lost in this, let me just, right here, just imagine there's a line right here. And above this is state. This is right now. And so you have state anger as a scale, and these 2 subscales compose this scale. Okay? State anger is right now to what degree I have angry feelings. Versus right here, to what degree do I have angry feelings related to verbal or physical expressions of anger. Okay? So those are the 2 subscales for state anger. That's right now. And that ends the right now assessment. Then we go to trait. Everything below here is trait. And first of all, we have just trait anger broken into temperament and reaction. Very commonsensical names. Temperament, how often does that child experience anger in general? Versus how often do they experience angry feelings that involve frustration or negative evaluation? In situations that involve frustration or negative evaluation. Okay? That's trait anger. And then finally we have the expression scales. How often are angry feelings expressed verbally or physically? Outward. Versus how often are they experienced but not expressed? So suppressed, if you want to go back to psychodynamic theory. And finally, anger control. Now, in the adult measure, anger control was 2 separate scales, anger control in, anger control out. We could not get them to break apart with youth, probably because obviously there's a lot of different reasons, but the brain is not as evolved, socialization is a factor, etc. So we have state and trait, and with trait we have just trait anger in general, and then we have expression, and then we have control. Remember, experience, expression, and control. Your 3 stages. Okay, so there was a chapter that I wrote, and this is an actual clinical case. Obviously, it's not the patient's name, but just to give you a very practical idea of the usefulness of a measure that looks at anger in a profile manner. So if you ignore state for a minute, let's just go to trait. So this was a kid who came in and the parents said, and he's 15 years old, he was in 9th grade, and they said, you know, he's just having problems focusing, and they thought, okay, it's probably, you know, something like ADHD. And so I gave him a battery of measures, and we took a look at the profile, and I looked at it, and I said, okay, this is kind of interesting. So look, this is how frequently he experiences anger, and, okay. And it's kind of in that middle ground there. Remember, this is percentile based, and here's your normal range from here to here. So here's your normal range, if you will. And this is low, this is normal, and this is elevated, and this is high. Okay? So now if we look at trait anger, well, okay, so he fairly frequently experiences anger, but on the other end, he rarely or very much less frequently expresses anger when he's evaluated or when he's frustrated. Okay, so then you start thinking, okay, so now let's look at expression. Okay, so he expresses it outward in the normal range, but look at that level of suppression. Okay, so then that starts to get even more interesting. Control's about moderate. So obviously the two things that stick out, this does a little bit, but you look at this difference, and then you look at this, and you think, what? Does anyone want to tell me what they're thinking? Somebody who doesn't express anger when they're evaluated, and they suppress anger to a very high degree. What other condition might you be thinking about? No psychodynamic theorists in the crowd? Nobody? Going once? Going twice? Starts with a D, depression, right? If you really suppress anger, and you also may tend to under-express when people are evaluating you, right? Depression, that old psychodynamic theory that if you internalize anger, it leads to depression, okay? So that would be an example of on how, when you look at it as a profile, it really makes a difference. So it's not all about hauling kids into a jail and throwing the key away. So, okay, what do I think is the destiny of anger? Where are things going to go? So I think that basically, to come back to this for a minute, we have truths we develop as we study phenomena, and then we start building typologies. You see it with the MMPI. You see it with all kinds of measures. A measure comes out, people start getting into, okay, here's some code types we want to look at. And then over time we get back, I think, to truth. So we say, well, we want to look at code types, but we also want to balance that with every person is different, right? I mean, the story is, if you went to a riverbed of stone and you measured every stone and you found the average size stone, right? And then you went back and you tried to find the stone that matched that exact number you came up with for the average, you might never find that exact stone, right? And to me, I always remember that in science. So I think that we will evolve subtypes with anger, just like we have with ADHD, with, you know, OCD, you have moral scrupulosity, one of my favorites with OCD. Even dyslexia, we have multiple subtypes. So we're going to get into subtypes. And the key is, I think, to really be playful like Cheeto with the anger crocodile. And don't trust type talk, because even though I talk about traits, you might think this guy's a trait theorist. Well, we could talk about preferences as well. But if you look at the literature on, well, is there even stability across kids? Because you could argue, well, okay, that was an adult measure, but we're talking about kids, they change so much. Well, there's been studies where actually there's a fair amount of consistency in terms of the trait scales for high schoolers from freshman to senior year, for example. So that's why with our measure we went with a primarily percentile-based measure, not a cutoff, not a above or below. We said low, average, elevated, and very high. Notice there's no diagnostic term in there, although this again can aid diagnoses. This allows you to look at low as well as high, and everything's as important as everything else, and it's more about the relative differences between scores than it is about one score. Okay, so I'm going to now challenge you all a little bit. Don't you hate those talks where they kind of throw it back on you? You just want to sit back and listen. And so I want people to think about, what would a depressive profile look like? And I started out with a softball because we talked about one, right? So you kind of know, right? And we can forget state on these following questions now. So they might, they could be anywhere on trait anger. Okay, they could be anywhere on trait temperament, but you might see lower trait anger reactivity, right? And you might see higher suppression, although we're not saying that that's the code type for depression. Okay? Because there's profiles big P and profiles little p. Big P would be like we start thinking this is the code type. Like they do that with with serial killers, right? And things like that. It's like, okay, this is the code type of a serial killer, right? I mean, no. There's always a new person out there with a new way of expressing phenomena. Okay, how about ADHD? That's a tougher one because it's like, what relationship does that have to anger? But remember that sometimes anger is what happens after a youth has had a condition for a while and they're so frustrated and no one's getting it that finally anger becomes the alarm that wakes parents up. I mean, I don't know if any of you have ever had that experience. The parent brings the child in, they're oppositional. I know you never get that. I know no one in here has ever gotten that, but they're oppositional. What do I need to do to, And it's like, okay, you look at it, it's like, well, anger was the alarm that went off, the little morning alarm that got him out of bed, but there's a lot more going on. But anger is what brought him in, and that's what brought him in. That was the loudest problem, I call it. Okay? So remember, when you're assessing people, and they come in, and it's like, oh, they're really an angry kid, you got to remember, anger is a complex process, and there's a lot of nuances to it. How about a potential school shooter? What would that profile look like? And I didn't say what is the profile of a scooter shooter. What would a profile maybe look like? Does anyone want to take a stab at what the trait scales would look like? Where would trait anger be? Okay, that would be higher possibly. How about, so trait temperament would be higher. Where do you think reactivity would be, trait anger? How would they tend to react when they're criticized? Low? Is that the predominating opinion? Yeah, low. Okay. Maybe. Or maybe they can handle criticism, right? And maybe they're the kid who's really hypersensitive and they're getting bullied and they have reacted and they overreact. And so that's led to them being ostracized. Again, flexibility and being dynamic with this stuff, but that's true. It could be very low too, leading to someone who is also maybe, again, high on suppression, building up of the anger over time, kind of on the fringes maybe, and finally just one day they decide, hey, I just need to, I just need to go in and I just can't stand these people anymore. Okay? Bully profile could look similar. An LD profile, I've seen a lot of kids with learning disabilities where their trait anger is fairly high, their reactivity's fairly high because they're used to failing and they're very sensitive to being criticized. Okay? Because they've gotten teachers who've said, why can't you do this? What's wrong? Their parents, come on, why can't you do this? They could be high or low on how frequently they express anger out. They could be high in suppression or very low, and their anger control could be very low, or it could be very high if they're en route to exploding one day. But again, it's looking at the profile, little p, but then keeping in mind the big P profiles that you can sort of compare it to. Low self-esteem. Which scale would you look for to determine what their self-esteem is? Which scale? Anyone? Which one? 3? Oh, you mean the third on the trait here? Yeah, that's the one, okay? That would be a good indicator of self-esteem. Okay, how about a child who's been sexually abused? Where might that come out? Or even abused in general? Thoughts? Variable, okay. I could see that. But give me one possibility. in the trait scales? Where maybe would you see that? Not just abused once, but let's just say over a year. Thank you. Again, that scale is a wonderful scale. That scale does so many great things. Clinically, this scale has just really, you know, when things are fuzzy, often, and it comes into focus, it's beautiful, right? I mean, all of a sudden, it's, oh, there it is. Okay, bipolar. Oh, childhood bipolar, right? Another under-researched condition that's snuck up on the clinical and research world. Where maybe would you see that? Any thoughts? That's a tricky one, isn't it? I guess it depends on the day, right? Okay. So actually, that brings up a good point. You don't just give these measures once necessarily. You might give it over many occasions. In fact, if you have a parent who's like, oh yeah, you know, they don't have bipolar. Well, okay. So you give the kid one of these when they're off meds and one when they're on meds and see what the differences are. Okay? Because if there's a huge amount of differences, then often it's like, okay, there's two different sort of ways of operating here. So there's a lot of ways to use self-report, a lot of different ways. How about your most difficult client that you have right now? Think for a moment. The one client you're just like, I just don't know what I'm doing with this person, or I'm not getting it. You know, we all have one of those, right, on our radar. It's like, think about, for that youth, or even adult, because again, the adult measure has pretty much the same scales. It's a little more differentiated. What would their profile look like, and can it help you get somewhere with them? For example, if they're a little higher on trait anger, then sometimes anger can be a motivator for clients. I mean, if you think of, okay, well, they tend to experience anger, but they can control it pretty well, so their control's okay, so they're not going to hit you. And they don't suppress too much, so they're not going to get depressed if you start, you know, working with anger in a certain way with them. Then you can think about, well, how can I sort of use the anger they do have to help them motivate themselves to want to get better, okay? Because anger is very useful as a treatment variable once you get to know it. So here's some descriptions of the scales, and I think I gave this to you as a handout. Let's see, what time are we at? We have 20 minutes? Okay. So I think what I'll do is I'll skip over these since they're handouts just for the moment. And really what I want to reiterate is there's profiles and there's profiles. And you're always moving between the little p profile and the big P profiles. But the beautiful, fun thing in anger research is there's just not many anger profiles out there. So again, if you're a researcher or you're a clinician, you could even write up an N=1 study on a really interesting client who has anger issues and probably, you know, publish it in something. Okay? So just take-home points. Anger is a psychological vital sign. It's a complex process. There's a variety of styles, and you really should try and think about using a measure that uses profiles. Now, our measure, there's really, let's see, there's one other measure by Ray D. Giuseppe, and I'm certainly going to, you know, talk about, or at least make you aware. There's a couple other anger measures, but of course, I'm biased. But you know, look at measures that really get at the complexity of anger, because there's at least, again, the 3 stages. There's at least 2 ways of looking at it, state versus trait. Because again, I think the practice standard is becoming, and this isn't just for anger, this is the clinical world in general. I think diagnostic yes, no kinds of categorical thinking complemented by a dimensional breadth, okay? Because that's going to give you the richness. And if you can do that quickly, then it's definitely, you get very good bang for your buck, clinically, research-wise. And again, you just have to be aware of the profile and the profile. So I think in terms of prevention and treatment enhancement, again, you can think of anger like gasoline. It can blow up, or it can get you a lot of mileage. Okay? You can use it as a pre- and post-treatment measure. And anger often lurks, kind of like OCD lurks. Like I gave a talk to the psychiatry interns. I don't know if any of them are here, but on OCD, one of my other favorites. OCD is just, those folks they're fun to work with. But you know, OCD lurks. It's so easy to miss. It's so underassessed. You know, it's like anger lurks as well. It's just kind of in the background. It doesn't necessarily jump out. But it's often a great entry point with parents. So, you know, try and wake up and smell the anger. And I think, again, I don't know why it snuck up on the research world, but it has. And just now I think there's more grant money with bullying, with suicide, with obviously the kind of violence. Threat assessment has yet to be well integrated with anger assessment, so that's what our research team's working on right now. And then we're also looking at, I don't know if Samantha's here. Is Samantha here, my research assistant? She's working with Dr. Beck's lab as well, but you know, also looking at anger and bullying and what patterns there are there, so we can work on prevention in the school. So, okay, shall I open it up to questions? Anybody have any questions, or anyone also feel angry about the lack of anger assessment? Or you can ask any question you want. Yes, Dr. Guman.
You know, one thing you mentioned early on, I have always thought too, like, why they're not aggressive disorders? If you can have depressive disorder, why they can't be aggressive? And similarly, you can categorize even the medication we are using a lot of time, although they are called antipsychotics.
Right.
We use a lot of them for aggression. So what's your explanation why that hasn't,
If I was to just, you know, sort of hypothesize, I'd say probably anger is more culturally accepted than anxiety or depression in American culture, as in the United States, number one. And so I don't think it sticks out as much. That would probably be my main reasoning. I don't know if anybody else can sort of add to that. It's boggling, and I don't know what DSM-5, I've heard talk about how they're changing things, they're moving ADHD around, there's been a lot of changes. I don't hear, actually no, excuse me. Ray DiGiuseppe, who I brought up before, he is come up with a syndrome called, let's see, it's anger, reactivity and expression disorder, ARED. And I believe, now that I think about it, he is working with DSM, and there may be an anger category for the new DSM.
Now with the children, they have, I think, temper dysregulation, something, you know, instead of bipolar, they're thinking a lot of these kids have temper kind of dysregulated problem. So
right.
There's a new category coming in DSM-5 for children. I'm not sure if it applies to adults too.
I'm not sure. I know that, you know, most of it would be misdiagnosed, like if the child just had an anger, and you're right about its dysregulation. I think some of it can be from head trauma. Sometimes you'll have that emotional dysregulation, you know, and then of course it'd be better diagnosed as a cognitive problem. So there's a lot of nuances that need to be worked out, but I am sure that within the next DSM or two there will be an anger diagnosis, because it's very prominent, and some people really, that's their primary problem. So
I mean, my thought was like maybe it will create some kind of legal problems too, how to deal with people. You know, if we say, you know, there is aggressive disorder and we start labeling them,
right.
Then what to do?
Well, right, that's right, and that's why some conditions left the DSM, where certain groups, you know, said, well, this is against this or that group, and so we all know the DSM is, you know, politically driven as well. So I think, though, that anger will force its way in because it's so right there front and center, and I think that it's become so prominent in our culture. You know, I mean, think of people who, do you have friends who they're fine and then you're driving in the car with them for the first time and somebody cuts them off and, you know, it's like, what happened, you know, what happened to them? So, and again, it doesn't have to be, it doesn't have to be a talk about just diagnosis, but just functionally speaking, dimensionally speaking, there's people who have problems with how they express anger, how much they suppress anger. You know, we can broaden it to a talk about sort of the facets of anger. And to me, that's in some ways a more interesting talk. There was a question in the back, or toward the back.
How you took the adult skill and were able to adapt it to children?
I knew that question would come. So, well, we did a lot of things. It's, you know, somewhat traumatic how many things we did. So I'm suppressing those memories currently, and that's going pretty well. But no, I'm just kidding. So, you know, we had to take the items. It was my dissertation, by the way. So for any of you who are about to do a dissertation, sometimes your dissertation can become a measure. You know? And by the way, if you want to really do a neat dissertation, do a dissertation on something that can become a measure. And that's a thought for anyone. As a student, think, is there a phenomena out there that we need a measure of? Because that's fun. It's really fun to do that. But we took the items. We first had to use a logical process of looking at, okay, would this make sense to a child? Okay, and if it was too adult-like, we had to come up with some possible ways to still assess for what that item was assessing in the adult, but using simpler language. Okay, then we did groups with children who would look at them. And we looked at readability, okay? And then we started with a much larger item pool, which is what you'll have to do if any of you all aspire to that much pain. And you'll have to do a large item pool, much larger than what you're going to end up with. And then you have to look psychometrically as well as rationally, and look both empirically and rationally, well, how are the items looking, okay? And then over time, you're going to call them out using those two methods. And then you're going to sort of after you come up with those items, give it again to another group. And of course, you need to look at normals and clinicals, and you're going to have to look at how it distinguishes anger compared to another measure of anger. How well does it only look at anger, specificity versus anxiety or OCD? I mean, you know, if you're thinking of doing something like this, I'm happy to, you know, to go into great detail, but you know, it's about a 5-year process. You know, so you know, I kind of joke at one conference. A woman was talking about, well, it took about 9 months to do the book, you know, like childbirth. And then, you know, I said, well, it took us about 5 years. You know, men take a little longer to do things than women. So, you know, 5 years, 9 months, you know, we still got it done. All right. Other questions? In the back, yep.
Looks like we're coming up with scales to identify it in order to diffuse it. But there was also, you mentioned in the beginning that it can be a very positive and useful emotion. And I wonder how many therapeutic approaches are in place right now to help people apply their anger in a productive way.
Right. Well, I'd first say this measure really isn't trying to diffuse the anger, it's trying to describe it.
Yeah, oh, I don't need to make
No, right, no, that's okay. I just want to be clear that it's not like, okay, we need to make this go away. First, we capture the facets of it, then we talk about how do we want to work with it. Approaches that utilize anger, I think any approach can utilize anger. I think CBT could utilize anger. I think there's acceptance and commitment therapy, evidence-based technique. Most therapies, though I'm aware of, tend to talk about moderating anger. So I think that's actually a really good question that you might want to study, which is using a measure that would look at the facets of anger. Can we come up with techniques that would more so tap, you know, the motivational energy that can come from anger? I think that's actually really a profound question. I think it's a great one. I've seen no research on that at all. That would be virgin territory. You'd have it all to yourself. You could just do a theoretical review of the research to start out with, and then look at empirically where do you want to go with it. That's a great question. And I don't have a great answer to it, I'm sorry. So, there was a question more in the front.
Yeah, it was partly answered by the comment before. But a couple of other thoughts. I think it's pretty clever to start thinking of anger by the way of a
Right.
dysfunctional, and when it hurts the person and others around them. I'm although not completely sold yet into the how do we break the trait and to what extent, I'm thinking of OCD, I'm thinking of depression, I'm thinking of mood disorders, I'm thinking of different personality disorders, and how even such things traits as access to conditions that really vary according to the state.
Right.
And so in terms of test reliability, things of that nature, how much does the trait change in this?
There's actually fairly high consistency, not with the very young kids, okay? But I think as they start turning, I think post-puberty, but even pre-puberty, there's a fair amount of consistency, actually. And again, I see what you're saying, because I'm very much, you can say, well, there's a preference or trait, but it can change situationally. But if you look, for example, linguistically across the world cultures, it's been very easy for Charlie, for example, to take his state trait measures and have them adapt into 27 or whatever, 48 languages for his measure of anxiety, the state trait anxiety measure. And it seems like across the world cultures, that is, if you think in terms of the human species, that there really are language and different languages often have words to describe right now versus kind of more generally. Because there's really something about phenomena that are more consistent or facets of a phenomena that are more consistent versus not. Now, arguably, it's not always there. That doesn't mean every time. The way I talk about trait or preference is relatively stable. Relatively stable, not always there. Okay? But I think you're asking a very good question. It's certainly not if they're high on one scale, okay, they're always high on it, like someone with bipolar, which is why I say you might want to give it at a couple different occasions, because the differences are as interesting as the similarities.
Recall bias, I imagine, is also pretty state-dependent.
What was that?
Recall bias is probably pretty state-dependent.
I didn't catch that first.
Recall bias, like you dealing with a bipolar person, you ask them about depression, they're manic.
Exactly. No, that's right. Of course, we factor all that in. I mean, interview, it's not like you ever would use this in isolation. Interview, an understanding of memory, exactly. All those factors play in. There was another question somewhere.